All set, Melissa? Oh, there we go.
Yep.
Okay, perfect. So welcome to everyone. You should have all heard the automated announcement that this meeting is being recorded. Per Governor Lamont's executive order, all public meetings must be recorded or transcribed and made available to the public. Therefore, in order to ensure a quality recording, I ask that everyone please mute their phones at this time and remain muted unless wishing to speak. Also, to assist in making the recording more clear, please announce your name each time you begin to speak. So for those that don't know me, I'm Nicole Godburn, Fiscal Manager with Rate Setting and Reimbursement with the Department of Social Services. What we're going to do now is go through, I'll take attendance for everyone. And then when we're doing the attendance, please also, if you have a guest with you, please announce who your guest is as well. Melissa will be recording everyone's names. We also too are going to have a little bit of a switch in the agenda. Barbara Cass has to go to court this morning, so nothing with her. She's perfectly fine. She just has to attend a court case this morning. So what we'll do is we'll just switch the agenda so that Barbara's items are towards the front of the agenda so she can address everything so she can make her case on time. So I will take now roll call. So Barbara Cass with DPH.
Good morning, Nicole. Good morning, everyone.
Matt Barrett.
Hi, good morning. I'm Matt Barrett, CEO of the Connecticut Association of Healthcare Facilities, and I believe I will be joined by way of phone from our association chairperson, Larry Santilli.
Thank you, Matt. Judy Dowd.
I am here. Good morning, all.
Good morning, Judy. Mag Morelli.
Hi, I'm here, and I'm also joined by David Lawler, who is the chair of Leading Age Connecticut and president and CEO of United Methodist Homes, and also Jonathan Fink, who's the reimbursement our reimbursement consultant from Clifton Larson Allen. And I think also Hillary Felton Reed is on, our lobbyist from Robinson & Cole.
Yes, I am. Good morning.
Morning.
And I also see Evan Dantos from our firm, who's also on.
Thank you. Mairead Painter.
Dan Lerman, Regional Ombudsman, sitting in for Mairead Painter today.
Thank you, Dan. And Michael Morris.
Good morning, I am present.
Thank you. And Claudio Guttieri from OPM. Judy, was he joining today or?
He didn't say he wasn't, but he was on another call when we talked to him, so he may have a conflict today.
Okay, thank you. Senator Moore. Representative Abercrombie. Okay. Representative Case. Okay, Senator Daughtry Abrams. Representative Steinberg. Senator Summers. Representative Pettit.
Only one who's awake, I guess. Here I am.
Thank you, Representative. Representative Walker.
Yes, I'm present. Thank you.
Two of us awake, Tony. Good job.
Yep.
Senator Minor. And Representative France.
Nicole?
Yes.
We just missed two folks. Would you mind if I just call their names to see? Because I'm not seeing.
I'm sorry.
Representative. No, that's okay. Representative Case. and Senator Austin. Okay, thanks, Nicole.
Thank you. And for those folks who were not announced, could you please introduce yourselves?
Hi, Emily Shepard from OFA.
Good morning, Nicole. It's Ken Prisby, lobbyist for CAHCF. Good to see you again.
Hi, Ken.
Sue Eccleston, OPM.
Larry Santilli, Athena Healthcare.
And Owen Rude from OPM. Morning.
I'm sorry, who was that at OPM? I couldn't hear
The second one was Owen Rude at OPM.
Oh, thanks, Owen. Good morning.
Hi, Melissa.
I'm Adelita Orifici, Chief of Staff to Commissioner Giuttani at DPH.
Okay, I think we have everyone. Okay, thank you all very much. Now turning to the agenda, as I mentioned, Barbara Cass has another prior engagement this morning. So what we'd like to do is just shift her items to the front of the agenda, just so we can make sure that we get to all of her items today. So Barbara, I will turn it now to you, and let me see, the first item on the agenda, Barbara, is the COVID-19 response update.
So thank you, Nicole. And again, good morning to everyone. In terms of the COVID-19 update at DPH, we continue to be engaged in COVID-19 activities. Specifically, our focus currently is compliance with Executive Order 13F as in Frank, which is relative to vaccination requirements for all long-term care facilities licensed with DPH. Lita Orifici is leading that effort, and it is a Herculean effort. So lots of time and effort has been expended towards monitoring and conducting our investigations as it relates to compliance with the order. We continue also at DPH to monitor incidents of COVID and respond accordingly. We are conducting infection control surveys at nursing homes, and we have resumed our normal activities as well. So for example, during the pandemic, the height of the pandemic response, CMS had issued a directive that suspended all survey activities. That has been lifted, and our routine licensure and certification activities and complaint activities has resumed, so we are working towards that direction. I will stop there in terms of our COVID-19 response, Nicole, if you want to talk about DSS and the Long-Term Care Ombudsman Program, or if you would like me to go ahead and report off on, I typically report off on quality issues that we may have identified since we last met as well.
Sure, Barbara, why don't you go ahead and do that, just so that we ensure that we get all of our updates from you today, and then Dan and I can circle back and touch upon the items from our agencies.
Okay, thank you. Again, thank you, Nicole, and thank you to the group for letting me juxtapose the agenda a little bit. We, as I mentioned, are doing our survey activities, and I do report off on the number of immediate jeopardies we have identified since we last met. And since our last meeting, we have identified in 4 separate facilities issues that rise to the level of immediate jeopardy. Just to refresh everyone's memory, immediate jeopardy is the situation that's been identified that has the probability or has presented an immediate threat to life or safety in the nursing home. So in the past quarter, 4 facilities, and the issues have ranged from resident choking to a facility fire and an inadequate response to the fire. We have identified immediate jeopardy in the area of neglect, monitoring for Legionella in a facility, and lastly, we have identified immediate jeopardy in the area of discharge planning. All of those situations have been corrected. We did remain on site in each of those facilities until we had assurances from the facility that an action had been taken to mitigate recurrence. That's the end of my report, Nicole. Thank you.
Thank you, Barbara. Barbara, actually, if I may, I believe we have a question that I just saw come through. Yes, Barbara, Representative Walker is wondering how many cases of COVID-19 are you monitoring to date?
We are currently involved in a focused infection control survey at one facility that is occurring today. I don't know, Representative Walker, the actual number of facilities that we are monitoring. I would say it is under 10 at this point. And when I say monitoring, that would be monitoring over the course of the last 28 days. Lita, I don't know if you have a better number than I.
Yeah, I do. I think Representative Walker might be referring to the ongoing. We used to do these charts that that told us how many nursing homes had staff cases, residents cases, in both staff and resident cases. Correct. And I'm just looking for Vivian's slide deck from this week, but I think we're in the single digits right now for total. The numbers are coming down. So if you give me a second, I can put it in the chat on what the numbers are.
Yeah, I'd like to know how many facilities and how many numbers, both staff and patients. So thank you. Thank you, Barbara. Thank you, Lita.
Thank you, Representative Walker. Thank you, Lita, for following up on that.
Yep, I'm just pulling up the numbers now and I'll put it in the chat. Thanks.
Okay, so just to open it up to ensure that everybody can ask questions of Barbara, are there any other questions of Barbara? Feel free to ask them or put them in the chat. I just want to make sure that folks have the opportunity to speak to her before she has to drop off. Okay, so hearing none. Okay, Barbara, thank you very much for your updates.
Thank you all very, very much. I appreciate it.
Okay, so touching back on the first agenda item, so I'll provide an update on the COVID-19 response update for the Department of Social Services. So today we are working very closely with the Department of Public Health. As a refresher for everyone, the Department of Social Services put forward several rate increases and financial supports to nursing homes in response of the COVID-19 public health emergency. If folks would like a refresher or a reminder of any of those financial supports, we have all of that information still posted on the Department of Social Services website. We've actually created on our nursing home page, there's a separate tab called Public Health Emergency. And if you click on that tab, that's where we have listed all of the financial supports that were given all the way dating back to last year in January, February, March of last year going forward. So you can see the entire history of those financial supports there. So feel free to reference that. Many of the financial supports were given in conjunction with infection control issues and other items that we felt were important for the Department of Public Health to work with nursing homes on. For example, safe cohorting of residents to ensure that there was infection prevention expert staff available. So all those financial supports went towards nursing homes. For that, we continue to work closely with the Department of Public Health to ensure that nursing homes are meeting those obligations and the money that was put forward. Also, as a reminder for folks too, in the most recent nursing home rates that were issued on July 1st of this year, Those rates included a 10% rate increase as well as a 4.5% increase. Per the Public Act, that money was put forward to nursing homes. The 4.5% rate increases to go towards staff wages, and the 10% rate increase is an across the board general rate increase for nursing homes. So just as a reminder, that money is in play. That money is being issued and put forward to nursing homes. And we have the full detail again of all of that on the website, so folks can check that out. That's all of the updates that I have. Dan, I turn it over to you. And of course, we're happy to answer any questions.
Thank you, Nicole. Again, Dan Lerman, Regional Ombudsman in the New Haven region, sitting in for State Ombudsman Maraith Painter. I'd like to raise just 3 points. Number one, with generally strong vaccination rates, we've seen key improvements in visitation and access issues. Second point, regarding visitation concerns, we advise residents, families, loved ones to use the visitation algorithm that the Department of Public Health has developed, which provides what if scenarios in different situations, and it's a very helpful tool. The third issue we'd like to bring up is concern about staffing levels in the field. Number one. Number two, use of agency staffing. Pull agency staffing, accountability of these staffing, folks, and some of the conflicts that occur between agency staff and regular staff regarding the significant differences in pay rates. Those are the 3 issues that we'd like to highlight. We'd also just like to mention that the Ombudsman program celebrated its 25th annual Voices Forum last week, and many of the stakeholders on the call attended or participated. So very much appreciated.
Thank you, Dan. Matt, I see that you have a question.
Yeah, thank you so much, Nicole. Dan, I just wanted to acknowledge the leadership of your office, and Maraith, especially on the staffing issue, and her work with identifying some of the perhaps unscrupulous pricing practices of pool agencies, and her willingness to reach out to both associations and gather information that I believe she has presented to the Attorney General's office and maybe even other members of the executive branch. And I just think it's so important that the Ombudsman office is doing that. It has a different feel to it when the Ombudsman is advancing an issue of that level of importance rather than the industry itself. We are also advancing it, but independently she has done so. And so maybe a big thank you and look forward to continue working with your offices on those pricing issues. And I'm so pleased that there are several prominent legislators on the call. The solution, we may need a legislative fix. Many states cap some of these pool pricing activities, and our neighbor Massachusetts, several other states, and we hope to have a good close look at that. But in the meantime, the idea that the Attorney General is reviewing that is very, very important. And also, as it relates to staffing, it sort of circles back to occupancy. Just wanted to briefly mention that occupancy DSS monthly reports on occupancy. Thank you, Nicole. And I think we were steadily increasing, but I think we're hovering around 78% occupancy. And I think our chairman, Larry Santilli, has observations about this as well. And we believe that occupancy growth is now very directly related to the inability to staff our buildings and to accept admissions. And so some of our earlier estimates of getting back to pre-COVID occupancy. And this is very much also related to the 10% temporary increase, which tracked this analysis provided by the industry. I think we'll be revisiting whether staffing is going to cause the sort of the runway to be longer than we originally anticipated related to recovery to pre-COVID occupancy levels. And so thank you, Nicole, for the opportunity to raise those issues.
Thank you, Matt. I appreciate that. And Matt, just to clarify, and Matt had mentioned census. We at DSS post the monthly census for all nursing homes and the statewide average to the DSS website. We just posted September, and September is at 77% statewide occupancy. But Matt is correct. We have been hovering in that 77, 78 statewide occupancy percentage for several months now. So that's kind of where we've been lingering at. Mag, I see that you have a question.
Yeah, I just wanted to follow up Matt's conversation, comments about the workforce, because I think that's an issue that maybe should be added to this agenda moving forward, because it's affecting capacity, it's affecting, as Dan said, and the ombudsman, we've talked to the ombudsman about this, concerns about quality, staffing levels. It's just finding the appropriate workforce and finding people willing to work within the nursing home, as well as across the healthcare field. So Matt and I are working with other associations representing other healthcare entities. This is not just the nursing homes, but it is affecting the nursing homes. So just wanted to flag that as a huge issue for us, and maybe an agenda item moving forward on this, for this committee.
The Executive Board of Resident Council Presidents has highlighted workforce development and career ladders for nursing home staff, part of the overall workforce development focus that we all think we're all working on and continued need.
I'm sorry, Dan, what did you say? You said career ladders, and what was the first thing?
Career ladders and workforce development. Okay. The Executive Board of the Resident Council Presidents, our Executive Board, Resident Council Presidents throughout the state, who are part of our statewide Resident Advocacy Board, have highlighted workforce development and career ladder development for nursing home staff as key opportunities moving forward. We appreciate the feedback from Matt and Mag.
Yeah, thank you, Dan. Yeah, and I think from a DSS perspective, just echoing what Mag was saying, we do hear from nursing homes directly who, yes, are having those concerns with being able to have enough staff to be able to meet the needs of all residents. So I think, you know, Dan, echoing to what some of the items that you were saying, we hear the same as well, that the staff is an issue, having adequate staffing for your buildings. So Matt and Mag, I kind of do agree that maybe we should have this as an agenda item going forward, just so we can kind of track this and watch how it develops over time, because we are hearing the same concerns as well. Representative Pettit, I see you have a question.
Yeah, just from the 35,000 foot level, I'm assuming that most of the extra 10% is going to salaries, realizing the money's completely fungible and can be used wherever. I assume most of it's going to salaries. Number one, I wonder if that's true. Two, in terms of the staffing, what percentages have been 1%, 2%, 10%? How many folks have lost people because of the vaccine issue?
I'll take the first part of that, and then Matt and Mag, I would defer to you on staffing related to the vaccine. So the nursing homes received in their July 1st rate 2 increases. There was the 4.5% increase, which is designed to specifically be used for wages, so that money must go towards wages. The 10% increase did not have any conditions attached to it. So I imagine that yes, some nursing homes will use it for wages. Some may use it for other parts of their business. What we do here in DSS is we'll do a full desk review and audit of that money after the fact. So once we kind of get about a year out from that, then we can look back at the cost reports and see how the money was utilized. So it will take us some time to understand that. But to your point, I imagine that yes, there was probably quite a bit of it used towards staffing and support, since we are seeing that concern pretty universal across the homes.
In your retrospective review a year from now is intended to be informational as opposed to punitive, saying, aha, we gave this, there was this 10% and geez, it was used, most of it was used for facility. So maybe we're way behind facility, but no, it was used for all staffing. Is it meant to be more informational for going forward and planning purposes?
So annually we do a desk review of the nursing home cost reports, and when we do an audit of nursing home cost reports. And typically what that process does is it looks at, there's specific items that the money given, the Medicaid dollars given to nursing homes is to be used for. When you say penalty, a home would only be penalized if they did not use that money appropriately. You know, that's, you know, not used towards resident care. If we saw something pretty egregious, then we would recoup. But typically we see the monies in nursing homes, about 51% of the Medicaid dollar that we give to nursing homes goes towards direct care. So direct care would be your nurses, your direct care staffing, about 51% of that goes to direct care, whereas the 49% of the Medicaid dollar that we give will typically then go towards the facility, your infrastructure, your administrative in general, kind of your business operation component of running a building. So that's typically how we see the money given. But my hunch, my personal feeling is that given that we are having such issues with staffing right now, and as Dan mentioned, we are seeing that disparity between the pool, the amount of money that a staffing member from an agency will receive versus you know, the typical money that a regular employee would see. My hunch is that much of that money may actually go towards staffing.
Yeah, Nicole, if I could just quickly add, from the industry perspective, Representative Pennant, we do not view the agency oversight activities as informational. They're just completing audits regarding a prior wage enhancement and prior enhancement of funds. And I'm becoming aware that there are, you know, several clear incidences where, and this money was not, there's no allegations of fraud here, but if the money wasn't spent in accordance with the purposes that the legislature or the executive provided it, DSS is moving forward with actual recoupments right now. And so we would expect the same level of oversight and scrutiny going forward with these dollars. I did want to emphasize that the legislature was very clear about this. The 4.5% increase is wage enhancements solely, and I believe that that's there's been no delays. I believe across the system, the nursing homes have moved forward with wage enhancements, and to the credit of the legislation that passed, it has a flexibility to it. It's not a 4.5% across the board to every single employee. The facilities have the ability to sort of earmark, you know, whether or not they need to move dollars into CNAs or RN or LPN or even infection prevention as positions. The competition is fierce for these positions, and nursing homes have to increase their costs significantly. And I also add that to the wisdom of the legislature in terms of a workforce development strategy, in terms of what you could do immediately. And there's all sorts of work going on concerning longer range strategies, but the implementation of a salary increase at this time, I think, was absolutely Connecticut could have done, and so we are so grateful to the legislature and the executive branch for moving forward with that. Of course, it had the other intended effect of averting a disastrous nursing home strike that was looming. But these dollars are not just for union providers or union employees. They are for the entire system. And I think that is giving the sector a fighting chance. As it relates to your question to the vaccine, I believe the DPH will be reporting out soon, perhaps this week or next week, regarding the experience or compliance with the governor's executive order. But the feedback we're getting from skilled nursing facilities that in combination with all of the education and frankly, the power, the stick of the governor's mandate and incentives that nursing homes were doing and education that nursing homes were doing, and the medical exemption process and the sincerely held religious or spiritual belief process, that we're going to see overwhelming compliance. And I think, I don't want to, I don't know for certain, Representative Pettit, but I think that we are going to see some of the highest compliance numbers in the nation, Connecticut, for nursing home staff. I hope I don't have to eat crow on that. I know the commissioner's Chief of Staff, Lita Orifice, is on the call and monitoring this closely. She's probably not prepared to report the final outcome, but I'm very optimistic based on the feedback we're getting that we're going to do well. I'm not sure about the entire long-term care sector, nursing homes facility. And by the way, I think there probably will be some incidences of either non-reporting or not high compliance, but overall, I expect that we're going to be way into the 90%. And then just one final quick observation. The 10% is temporary. I think the legislature and the executive branch were very clear about that. And it's just to add to what Nicole said to it, it was related very much, and it can be used for wage enhancement also. There is a flexibility to it. But that money, I believe, was provided directly associated with the revenue loss and the increased costs associated with the revenue loss, and also directly related to the occupancy decline that nursing homes experienced during the pandemic. And I kind of always described it as a runway, or as we're regrowing and as we're rebuilding occupancy, the legislature and the executive branch recognized that we had to shore up the system in a temporary way. And that's why I made the comment earlier on. This was based on occupancy regrowth that I think is now sort of hovering at 77, 78%. And it's not related to demand for skilled nursing facility service. It's really, we think it's directly related to the inability to staff the building and an inability to take admissions. That's why occupancy is in part hovering. Anyway, I'm taking too much of airtime here, but I did want to respond to those comments. Thank you, Nicole. Thank you, Representative Pettit.
Mag, I see you have a question or a response.
Yeah, and I just wanted to follow up on Matt's excellent response. So I don't want to repeat what he said, but I just wanted, since this is the Financial Advisory Board, to just make the observation that one of the big issues that we had really advocated for this session was the fact that we needed funding for staff and for wages, but we also needed funding to catch up on all those, as Nicole, you said, all those other business expenses, the building in particular. We talked about fair rent in the building and being able to invest in the building and all the other costs that were calculated into our rate, but not necessarily paid in our rate. So I just wanted, I think people are addressing that. I think there was some funding, some of the ARPA funding was put into the budget to at some point address that, to help provide grants. I think we have additional social worker ratios that we're going to need to meet, and there was some funding put in for that also that we appreciate. And I know that DSS has put out the grant applications for. And I think when we get to the acuity rates, we'll see that there's really was an effort from the state to try to catch up on those other costs. So I just wanted to draw that attention to that, and that's where a lot of the 10% might also be going to, just to address those sort of costs we have, the financial losses, but also some of the costs that are in your calculated rate right now.
Nicole, a quick follow-up, if I may. So adding to the wages, is it, Mag and Matt, is it your perception? Do you know if most of that goes to the entry level, getting people in, given the competition with other service industries per se, or is it with the increasing rates of pay every October 1st? Is it the wage compression? So it's the people that have been there for 3, 4, 5 years, sort of the middle level. Is it going to the entry level or people above to push them up to keep them competitive? Do you have any idea how that washes out?
All of the above.
Yeah, I don't think we necessarily know how that 4.5% will be spent just yet. But Mag is correct. We will see a kind of across the board. You may see, for example, that you might see a bigger bump, for example, if a home is experiencing a need for RNs. So for example, I think it's going to be individual per each building. So you may have a home, for example, that really needs to attract RNs. So maybe they're going to offer a bit more wage enhancement there. Or you may see larger increases for your CNAs, to really build that capacity in your staff. The 4.5, as Matt mentioned, wasn't going to be 4.5 for each staffer. What you'll see is that maybe, for example, the CNAs get a bigger bump to bring them up a little bit, and the nurses maybe get, a couple percentage points to increase them, since they typically get paid such a higher salary anyway. Many of the homes are participating and taking part in the paid CNA job training programs. So many of the nursing homes are participating in that to try to attract new staffers to their buildings, to get folks working within their facilities, and hopefully those paid CNA programs will lead to long-term workforce development. The hope is that you can get somebody in there, pay them to be your CNA, and they stick with you for multiple years and become a long-term staffer. So I think nursing homes are using lots of creative ways to attract staff, but it is, I think we'll be able to report out once we kind of get a little bit further away on how they actually use the 4.5%.
Yeah, Nicole,
Matt?
just for the purpose of emphasis, I just wanted to, just for the purpose of emphasis, say there is no question that the overwhelming lion's share of that 4.5% is going to be to the direct care workforce. That is certainly where it's going to go. I just really wanted to acknowledge earlier that both in the legislation that there is a flexibility. It can be used for other workers, and there are lots of different needs, and we're hearing getting a lot of feedback of other parts of the healthcare hospital systems in particular. They're paying bonuses and recruitment entities, and so if there is anything sort of left over, if you will, after this these major increases to direct care staff, then these dollars can be used in those other areas as well, which is really a good thing.
Mag, did you want to respond?
Yeah, I just wanted you sort of to give the bigger picture too. The need for staffing, and we think of the direct care CNAs and RNs. There's a real issue with RNs right now in a lot of the buildings. We need 24/7 coverage of an RN, and they're in great demand throughout the healthcare field. But we also have a dining room. We have dining staff. We have chefs. I know people are having really trouble recruiting chefs in, dining managers, recreation therapy. And then just outside of the 4.5 and the other expenses, as everyone is seeing other expenses, food, supplies, and all of the other, goods and services that everyone else is seeing in this current pandemic shortage era, the prices rising. Nursing homes are seeing that also. And then if you have a campus, so your nursing home is part of a campus that also has independent living and assisted living. When you give that 4.5% in raises, the amount of money in raises to your nursing home, you need to provide those raises throughout the campus. So there's a lot of, and quite frankly, people have to do that in this workforce environment because staff in those areas are also hard to come by. But the financial pressures are just building on all these different levels, and that's why you're seeing this. So as grateful as we are for the money, it's being spent as fast as we can get it, and really trying to recruit people onto the campus.
So if there are no further questions on that. Okay, so moving forward through the agenda.
It's Larry Santilli. I just wanted to make one comment on that. In Massachusetts, we have a cap on pools, and I probably use 8 times more pool in Connecticut than I do in Massachusetts. So what happened, I know Representative Pettit was referring to, did the vaccine cause the shortage? No. the shortage was caused way back when this whole epidemic started, and people have not come back to work. Now they're coming back, getting paid a fortune by the pools, so that we can't compete with at all. I've never seen a nurse's aide shortage like I've seen now, and most of my money is going towards the nurse's aides, dietary aides, and all that. But even at that, we just can't. It's impossible. So I would love to see a cap on the pools. And when the pool comes in, you have to check to make sure they're vaccinated. They're not part of the team. I mean, it's not ideal for patient care by any means. And in Massachusetts, again, it's worked very well, even though we have a shortage, by capping these pools. The sooner the better.
Thank you, Larry. So moving forward through the agenda, Barbara has already reported out on item number 4, the survey activities. So moving to item number 5, receiverships, closures, and bankruptcies. We have one facility in receivership. This facility has been in receivership predating the public health emergency. There have been 0 homes in bankruptcy. For closures, we do have 3 closures, and for folks, you can start referencing what we've done to our monthly census report on the DSS webpage. Is we are listing now for folks to see the closures. If you scroll all the way down to the bottom of the report, you will see the facilities that have closed. We are also listing bed termination numbers. So we know that as homes are looking to how they can either repurpose space or how they can change their facility structures as they come out of the public health emergency, we are seeing many homes coming in for bed reductions for a variety of reasons, either to change the footprint of their physical building or to address the 3 and 4 bedroom requirement that was put forward by the Department of Public Health, that homes are not to have 3 and 4 bedrooms so that residents can be safely cohort. So we are seeing a variety of different applications, certificate of need applications coming in from nursing homes related to bed terminations. So we are tracking all of that now on our monthly census report, so you can see that information posted there. And just note the effective date on the monthly census report will be the effective date from the Department of Public Health, since they are the ones that officially terminate the beds and also officially terminate the license for a nursing home. So the effective date listed will be that of the Department of Public Health when they officially put that date forward. So that's why you'll see on the census report that there's some homes listed as closures, but no effective date just yet, because the Department of Public Health is going through their process right now on that. So any questions related to that? Hearing none. Okay, so the next topic I think is one that everybody's very much interested in, the transition to case mix to an acuity reimbursement system. So I again defer folks to our nursing home webpage on the Department of Social Services website. Because on September 29th, we hosted a webinar with the entire industry. So all the nursing homes participated. It was an open public meeting. I believe we had over 250 folks participate in this webinar. On the September 29th webinar, we put forward our plan to address the phase-in process for the acuity reimbursement system. We heard loud and clear from the industry that to flip the switch come July 1st of next year, to just flip to an acuity-based reimbursement system would be a shock to many nursing homes. So what we've done is instead developed a 3-year phase-in plan. That 3-year phase-in plan will slowly walk nursing homes towards the acuity reimbursement system. So there's all the detail posted to the website, but to give you a general overview, the first year of the 3-year plan will be a hold harmless year. So in that first year, nursing homes will not see the rate that they're paid. The Medicaid rate will not actually be the acuity rate. Instead, what they'll be given is a shadow rate Every quarter, the department will issue to nursing homes a report that shows what their acuity rate would look like if we were reimbursing them under an acuity-based system. So it will be a shadow rate for informational purposes only. The homes instead will be paid their rate as they are typically paid today. So that will be the first year of the 3-year phase-in, so it'll be hold harmless year. In year 2 of the phase-in, we're going to slowly open up corridors. So that process for the phase-in in year 2 will allow nursing homes to slowly step into the acuity rate and give them some predictability. They will continue to be receiving their quarterly acuity reports so that they can see how their rate moves each quarter. But in the second year, what we've done is put guardrails on the system so that a nursing home will lose no more than $5 to their rate and gain no more than $20 to their rate. Sorry, I'm just bringing up the spreadsheet now. So that phase-in will slowly open up the corridors for the nursing homes so they can slowly start stepping into their rate. Then by the time that we get to year 3, what we'll do is we'll completely open up the system and the nursing homes will see the full impact of the acuity rate on their system. And we've put together a spreadsheet on the DSS website so you can actually see home by home based off the information that we know is true today. What you can see is the impact of home by home of how that 3-year plan looks like to the nursing homes. So as a reminder, the acuity system will adjust every quarter based off the MDS data that the nursing homes submit. So that will influence the rate. So again, just you can go to see the spreadsheet and see the actual impact of those homes over time. We've also done the spreadsheet to list by management company, so you can see in totality how the management companies are affected for their entire company. So we put a ton of detail in there for everybody, so you can go ahead and check that out. We also too, touching upon value-based reimbursement and quality. What we'll do is we've been working closely with the associations and we have been hosting stakeholder meetings, talking about value-based reimbursement, what items around quality are important to us and how we would potentially like to see a value-based reimbursement system look like. As you know, per legislation, that's part of what the acuity system is to incorporate. But what we'll be doing is in the first year of the 3-year phase-in, there'll be a reporting only period. So homes will be issued a report on how their quality looks like, but their rates will not be impacted at all by a value-based system. And it won't be until year 2 that we'll start to incorporate impacts to reimbursement for that quality component. That's the current design of what we're looking to go, but we still have many stakeholder discussions that we need to have about what quality components are going to be important to the state. What are the areas that we would like to see for homes to do better on? So we still have lots of discussions to do on that, but that's kind of loosely what we're looking to do for a value-based system to layer on top. So with that, I'll pause if anyone has questions. Mag?
Do you want me to post the page that the rate information is on?
Yeah, could you? That'd be great. Thank you, Meg. Thank you, Meg. And I would like to point out that thinking through a phase-in program for acuity requires the state to support that with some funding. So because we'll do a hold harmless year and because we will slowly open corridors in year 2, that does require the state to put forward financial supports to support the industry. So that information we will be posting as well to the DSS website, so you can see that information. Some of that is listed in this slide deck, in the stakeholder slide deck that's posted from the September 29th So just to point out to that, and we'll get more of that information posted to the DSS website as time moves on. Okay, so seeing no further questions. Moving on to item number 7, the 2020 and 2021 annual committee reports. Melissa, this was to be Barbara's item, but I think for here we were just asking for a vote.
Nope, we already did. We're all set. So it was just a general update that the 2000, we had a slight delay in the transmission of our 2020 report because we were transitioning commissioners over at DPH, but we are all set now. So our 2020 report is about to will be submitted this week to the legislature. And then, if you can believe it, after this meeting, this is our last meeting of 2021. So we will start the report for 2021 so that that can be submitted right after the new year.
Thank you, Melissa. So moving to item number 8, I did have one item here, and then I'll open it up for folks if you have anything else. So for other business, we do need to confirm, as Melissa mentioned, this is the last meeting of this year, but we do need to confirm the 2022 meeting schedule. So I think, Melissa, we need a vote for this.
Yep, and let me just pull it up. I'll share my screen for everybody so you can see the proposed schedule. It's exactly the same as what we're doing now. We're proposing to stick with the second Wednesday in the first month of each quarter. So let me see if I can share my screen, and then we'll just need a. So this is the proposed schedule.
All right, I move adoption of the proposed meeting schedule.
Second.
Was that you, Mag, who seconded? I'm sorry, I'm sharing my
Yes,
screen.
me, Mag.
Okay, thank you. Yeah.
Are we in the discussion phase of the meetings?
Melissa, I think you're on mute. I think you're trying to.
I don't think I'm muted. Am I?
Oh, okay.
Now we can hear you.
Yeah. Is there a question for me?
Yeah, I just want to put out there, the location to be determined. I don't know how people felt about the Teams meetings, but I think it makes it much more. I think we've had great attendance by using the Teams format. So I just wanted to put that out there that I, think maybe we should consider continuing it if possible.
Yeah, Mag, I agree. I think we have a better turnout when we do it via Teams as well, so. Okay, so if there's no further discussion, I guess we can take a vote on
Melissa's talking, but we can't hear her.
No, I'm not talking.
So hearing no further discussion, so adoption of the 2022 meeting schedule put to a vote.
Aye.
Aye.
All in favor? Aye. Yep.
Aye.
Any opposition? Nope. Okay, so hearing none. Melissa, I think we can go ahead and adopt.
Thank you.
So I'll open it up then for any further items on the that folks would like to discuss.
Just if this is our last meeting of the year, I just wanted to just say the appreciation of the support that we've received through the crisis. I know we're still in the midst of the crisis. Hopefully it's coming to an end soon. But just to acknowledge, not only appreciate the support that has been given to the industry, the recognition of what we've been through, but also I think these meetings have been very, very helpful. The agenda, the set agenda, and the participation. So I appreciate it. Thank you.
Thank you, Mag. Okay, so hearing nothing else, then make a motion to adjourn.
So moved. Second.
Perfect. All right. Thank you all so much.
Thank you, everybody.
Thank you.
TTFN.